Have you seen people get better after removing surgical metal from their body? Yes. I told the story about a patient years ago who really got me thinking about the whole EMF thing. And it was very interesting. He was a big strapping guy. And, you know, as always, I tried to find out, get his actual story. And his story was that his job, which he, you know, did normal, like 40 plus hours a week, was installing high-end Wi-Fi systems in usually pretty wealthy people's houses. And he did that for years and was fine. But interestingly, I asked him about his life, and one of the things he did was, because he liked to, every morning, or probably not every, but most mornings, he went surfing before work for at least an hour, sometimes 2 hours in the waters off of Santa Cruz. So he was basically swimming-ish with a wetsuit probably in salty water in the sunshine 2 hours a day. And then he went to do the Wi-Fi wireless installation, and he was fine. Then at one point he, I think, fell off his board or something, and he fractured his wrist. I don't remember which wrist. And it was bad enough so they had to put a metal plate in his wrist. And it was right where you would test for the pulses in, say, Chinese or Ayurvedic diagnosis. So it was a serious sort of gathering point for his energy flow. Within weeks of having that plate put in, he comes down with what was called fibromyalgia and chronic fatigue syndrome, to the point where maybe 6 to 8 weeks later, he was totally disabled, incapacitated, not able to work. And he came to me because of heart arrhythmias. And simply put, the solution, to me, that story, the problem was, his original therapy of swimming in salty water, ocean water in the sunshine, he was not able to do because he hurt his wrist. And they put a metal plate which acts like an antenna, and that interfered with the energy flow in his body, and that completely accounted for his symptoms. And I convinced him to have the metal plate taken out and at least sit in the ocean water, at least up to his feet or, you know, knees or something. And as far as I remember, 6 months later, he was back to normal. So that was a particularly dramatic story of exactly what you're talking about. If you have metal in you, you should consider getting it out. But, you know, you always have to weigh the risk of having another surgery. So if you're fine, maybe you don't need to do that. I never usually recommended people having even a restorative surgery like that if they were actually fine, but I would be on the lookout that at some point you may not be fine. And that also goes for things like fillings and root canals and artificial hips and anything, pacemakers, all the rest of it. Now, again, I'm not telling anybody to get those things, get a new hip, because there's no other choice really. But I would think twice about having any of those things. And if you're having problems, that might be the problem. And depending on the situation, sometimes you can do something about it, sometimes you can't, and you may have to do some other kind of remediation.